Now, UCT Civil Engineering Lecturer Gundo Maswime joins us for more as we expand the conversation, really just looking at the budget that has been allocated for infrastructure development. Gundo, very good evening to you. Thank you so much for your time. A substantial amount of money has been allocated for Gauteng's crumbling infrastructure, 36.6 billion rand. What can it do?
The money itself is not a problem. It looks like it's a significant amount that should make a dent on infrastructure in Gauteng. Because if you look at the size of the province, the area, it is not as big. It's actually almost the size of just Vhembe district in Limpopo. But the challenge is what that money will translate to in real terms. That means the sense that the money that is spent that yields impact. Gauteng has had a challenge that other big cities like City of Cape Town have had before, where a decision is made to reconfigure the infrastructure clusters in such a way that things go into places that they should not go. Most of the time, it is done just to avoid certain personalities participating. Maybe they feel that somebody is not competent enough, and then so Gauteng has done something like that, where some of the schools are built by DBSA, some of the clinics are built and maintained by the Department of Health, and then the Department of Infrastructure has got some of the health facilities and so on. So that scattering of the service, he actually mentions in the speech that there's been challenges of underspending or late approvals and poor contractor performance and so on. Those were contained at DID. They should have strengthened DID and make it as efficient as possible. But the taking of some of its activities across is in such a way that you will find DBSA cannot do community consultations easily, something DID is now very good at. Managing of subcontractors, you will find Department of Health will struggle with that because in DID they have a unit that's doing that. So that whole shifting and moving of things around, instead of focusing on solving the problem where it is, you export it to other departments and you export new problems that you've already solved. So that is going to cause a lot of inefficiencies. The maintenance done by Department of Health should be substantially more expensive than what DID was doing. So that money will be spent, but the impact will be less if they don't rationalize the infrastructure cluster.
Yeah. It's important that you say that, because then it speaks to the level of accountability which is needed to address these shortfalls in infrastructure in the entire value chain, because the numerous challenges faced by the Gauteng provincial government departments, entities, implementing agents, contractors, professionals and so forth cannot be ignored. So with this budget being allocated, where should the focus be, and perhaps where is the MEC just missing the mark? Because it's all well and good to announce this money, but of course the devil's in the detail.
Yes, it is in the detail. In fact, the outlining of the budget, I'd expected that it will be completely aligned with the 13 priority areas that the Premier presented in the state of the province. He did mention it once or twice, especially on the Department of Roads and Transport, which was a relief. But if you look at those 13 priority areas, they are in one way or another linked to public infrastructure, to the point that even the issue of crime, crime is always associated with areas where that look neglected. Even when you walk there, you will not feel safe. So that, in a way, has got a very strong link to infrastructure. But to go into the details of how do you rationalize the provision of public infrastructure in such a way that you build a learning organization or a learning government that learns from its mistakes and improves, instead of taking a function away so that new mistakes are born because you you end up burdening departments that do not have the capacity for some aspects of the infrastructure. So in DID, they were looking at the full value chain. And yes, they did have problems. They have invested now a lot in new monitoring mechanisms like a nerve center type of arrangement. They used to have one which So now if they are getting their act together, what they need is support. And they also need capacitation, because he mentions that there is a lack of capacity when it comes to planning.
Yeah. We also heard the MEC revealing that the focus is being shifted now to infrastructure projects that are both sustainable and have a direct impact on increasing the revenue system, economic growth. And, what do the research findings conducted on infrastructure projects of this nature reveal?
So there's a whole body of work on the impact that infrastructure, different types of infrastructure will have on the livelihoods of people. In fact, the United Nations has done work on the impact of certain types of infrastructure on the Human Development Index. There's a big claim that if you can provide efficient transport infrastructure like roads, and people have got access to good quality education and health facilities. In one generation, you can change the fortunes of a neighborhood. So that there's a lot of data on that, with the examples of small towns in Europe that used to be poor 100 years back. But with just the advent of modern transport networks, they were able to get all that connectivity, and then they've got access to quality health facilities, educational, and so on. So those priorities are welcome, and it was important for that the MEC actually pointed those out. But now it requires a rationalization of the service, so that you have got a full view of what is happening, because the Department of Health will focus on what is health. The Department of Roads and Transport will focus on what is road and transport, and so on and so forth. So to actually get all these things running together, it was always best that they should be centered in the Department of Infrastructure. The other thing is that they've got a lot of community project stoppages. Now, what exacerbates that is the fact that DID would have been, the Provincial Infrastructure Department would have been rolling out their projects in a particular way, paying a certain amount to general workers and, the different trades within a project. Yeah. Now, you will find health does not use that, and they skip a step. The community already knows how projects are done, and when they see those changes, now you don't have a template anymore. That becomes a very big problem. So I think they must really think about the ration. Even if other departments are doing that, let DID still continue to lead.
Absolutely, very well. Thank you so much for speaking to us this evening and weighing in on this discussion. UCT Civil Engineering Lecturer Gundo Maswime giving us a sense of the 36.6 billion rand budget allocated for Gauteng's crumbling infrastructure.